Scientists in this Melbourne lab are ramping up a homegrown test for coronavirus.
I understand that 80,000 tests done around Australia for coronavirus so far. As of this morning, Victoria's done about 20,000 and they would have all been using homegrown tests.
The Australian-made test has been critical to boosting our much-needed supply. Of the 80,000 tests administered across the country, 20,000 kits came from the Doherty Institute.
So this is an example of a positive result.
And the government has now ordered almost 100,000 extra coronavirus test kits from the United States to keep up with the demand. Currently, you should only be tested if you've returned from overseas in the last 2 weeks and have respiratory symptoms. If you've been in close contact with someone who has COVID-19 and you show symptoms, or if you have pneumonia and doctors don't know the cause.
The reason we have some idea of community transmission is that many doctors decided this wasn't a good policy and started testing others themselves. And we really need much more testing in Australia.
This is the time where if you've got a cold or flu or runny nose, you really should not be going to work because, there is that very small chance that it's COVID.
Authorities say if we tested everyone that had a cough or cold, it would use up valuable tests, as well as equipment like masks, which are needed by people who are caring for the sick.
If we tested everyone, we might be doing 10,000 tests, using up all those gloves, gowns, masks, reagents, extraction kits, and maybe need to test 1,000 to 10,000 to find one person that's positive.
While testing remains limited, experts agree the situation is changing rapidly and more widespread testing may soon be needed.